kind of like, how do you know which diet based on what symptom of your child to follow? Because, you know, there's all these different ones that we talked about, and there's GFCF, SCD, and then all the different pieces, and there's symptoms in a child that you can look for to know which diet is best for them. So I think all of us probably would have an opinion. Julie, you want to start with that?
Sure, it's a great question because it's the thing I probably spend most of my time in my practice determining is what diet somebody needs, as well as what maybe combination of diets somebody needs. And to answer which diet to do is the hard part. I would say that in general, people often will start with gluten and casein-free first and then go to the specific carbohydrate diet if they need it, and then often incorporate other principles, whether it's fermented foods or body ecology diet principles or low oxalate principles, phenol principles. You know, which one to do would be depending on which symptoms somebody had. And so, you know, actually, on Friday, I'm going to be going a lot more into each of the diets and some of the symptoms each of them typically present, and some things to look out for, as well as some things that benefit each of them, because that's probably a 15-minute discussion at least. And so I don't know if I could answer specifically the answer. I would say that it kind of goes along with one of the questions here is, what if my daughter likes a little bit of food with her ketchup? That would be the perfect example of how I would determine where to start. So if there's someone really obsessed with a food, doesn't want to eat anything except for that food, I'd start there. And so in the case of the ketchup answer, I would say I would consider tomatoes an issue, and I would consider phenols, because tomatoes are phenols, or I would look at the nightshades. Or so sometimes that is a good way to go. If you can make a correlation to a particular food, you might be able to work backwards and figure out where their challenge is. I mean, that's kind of to start.
Yeah, I'm sorry, go ahead.
No, that's what I was going to say.
The comment that I'd like to make, based on research, I know the gluten and casein-free diet does show a great result fairly quickly, but even more than whether it's GFCF, SCD, the first diet that I would start would be a healthy diet, a balanced nutritional approach. Make sure you're balancing your protein, carbs, and fats, getting good sources of protein, non-GMO produce and things like that. So whatever diet you do, the most important aspect of that, in my opinion, is that you have a balanced nutritional diet.
That's a great point. And the last thing I want to say, one other thing, we've talked about the corn on and off today. If I have a child that is having really strong aggression, we have seen a big pattern of this over the last 5 years in our clinic, that the kids that are really aggressive, frequently corn is one of the triggers of that. So if you have a child that's very aggressive, just try removing corn for a week. You'll know probably in just a couple of days if corn is a factor, but that can be a big reason for aggression. Digestive problems, take them off of soy. You know, there's so many different other areas, but we've got a lot of questions.
Can I just follow up on that? So if corn is an issue, do you mean corn is an issue because they have gut bacteria? Do you mean corn is an issue because there's a yeast, or it is a corn intolerance?
It could be a combination. Corn intolerance is actually doesn't tend to be as big on the IgG that we have seen. But there is the brain allergy component, because our brains will build antibodies to certain foods. And there's, especially we've seen a big subset in the clinic of kids in more the young teenage range that corn will make very, very aggressive. A lot of things were in, you know, you're going to be learning a lot about vaccines over the next couple of days. And a lot of things have been in our vaccines that have caused a lot of problems, and we don't know where they came from. Eggs being one of the biggest one. I mean, it's certainly one of my theories, as is Lisa Lewis's, and a lot of us who've been doing this for a while, that is the fact that eggs, so many of these kids are allergic to eggs is because so many of our vaccines were cultivated on eggs, and that was the first immune response that we had. So there's other things to think about, but